Good afternoon. Thank you for joining us for the Dean's 2024 Distinguished Lecture here at the Health Education Campus. I am delighted to be able to introduce Dr. Gary Beven, who is celebrating his 35th class reunion, as you can see, class of 1989. And Dr. Beven serves as the chief of the Space Science Medicine Operations Division at Johnson Space Center in Houston as part of NASA. He leads NASA's human spaceflight program. His team of flight surgeons, biomedical engineers, psychologists, space radiation physicists, scientists really do serve to help oversee the issues related to space travel for us as humans, and the astronaut corps, an incredibly dedicated group of individuals that are helping us understand the risks and benefits of the exploration of space, including the International Space Station, the commercial crew, commercial low Earth orbit, the Artemis project, and as we all know now, the challenges of having both federal and commercial space flight. And having a son active in this space, active in this area, as I was just mentioning to Gary, has put me close to the areas of interest in this, and I'm delighted that there was time spent with the aerospace physiology group this afternoon. The challenges of these programs are, in fact, complex for all of us to understand, and I think Gary is one of the world's experts in this area. And my hunch is that you all remember this talk as we see space exploration expand over the next half and full decade. Dr. Beven, as a physician, understands these issues, and there's an incredible good core that he leads at the Johnson Space Center. And the spectrum of events that occur with astronauts is actually quite amazing. I had an opportunity and honor to receive some NASA funding myself to understand my world, which is the effect of deep space travel on hematopoietic stem cells. We did some esoteric work, but stem cells, I think we all agree, are pretty important for our lifespan. But I got to realize that one of the fundamental challenges, if I may say, is that astronauts are private individuals doing a public service, but all of us investigators would love to look at them as guinea pigs, which they are not. And so understanding how to navigate their protections as a very small group of individuals and understanding the risks that they're taking and the health benefits and health risks and health recoveries is really a complex task. And I'm sure that Dr. Beven will be able to speak to that. Dr. Beven is well recognized in the field, having received the Spaceflight Awareness Silver Snoopy Award. Understanding behavioral health issues of our astronauts. He's a recipient of the Aerospace Medical Association Reynold F. Longacre Award for Outstanding Accomplishments in Psychological and Psychiatric Aspects of Aerospace Medicine. He received his undergraduate degree at the University of Colorado in Boulder, interned at the Cleveland Clinic in psychiatry, and then spent time at the University of Colorado in medicine, and was trained in forensic psychiatry at the University of Florida. He's a retired U.S. Air Force lieutenant colonel and a flight surgeon with 24 years of military experience, and so I'm delighted to turn the podium over to Gary, and we'll be eager to listen and learn. So thank you for coming.
Thank you, Dean. Can I get a sound check? People hear me okay? Great. I really am very grateful to be here. And Dean Gerson, thank you for the invitation to speak today. And as Dean Gerson said, I'm Gary Beven. I work full-time at the NASA Johnson Space Center in Houston, where I've been a physician there for the past 20 years. And it's really always a great privilege for me to describe to everyone in the public whose tax dollars pay for NASA all the great work that we're doing in the human space program. Two of the goals I have for this is to, if you're an experienced physician, perhaps even toward the end of your career, to think and imagine yourself perhaps going back in time and working at the Johnson Space Center as a NASA flight surgeon and experience what I'm going to show you. And especially if you're a younger physician, a medical student or a young physician, I want you to know that there is a pathway for you to one day become a NASA flight surgeon and to work directly in the human space program. And I have some information, some slides that'll showcase that as well. Now, NASA, as you know, it's a federal independent agency, and in my opinion, one of the greatest federal agencies. It always has the award for the most content or happiest federal employees. We do great work, and the vision statement is NASA explores the unknown in air and space, innovates for the benefit of humanity, and inspires the world through discovery. My division, the Space Medicine Operations Division, has currently the world's greatest amount of expertise in the unique field of space medicine. Space medicine is a subcategory of aerospace medicine, which is a component of preventive medicine. We have 450 personnel in our division, and we're completely dedicated to the human spaceflight mission. We work directly with astronauts. We help select astronauts. We work with them during their training, pre-flight, in-flight, and post-flight, and then we work with them after they retire toward all the way to the end of their lives. And so we have a tremendous amount of experience. We have biomedical engineering experience, operational psychology, space radiation. We have a science mission, and we also have epidemiology and data analytics. The Johnson Space Center is in Houston, and the first words from the lunar surface were Houston. Of course, Houston, Tranquility Base here, the Eagle has landed. And I still remember seeing that live, where my parents woke me up and brought me to the watch TV as a black and white TV, where I was growing up in Cleveland Heights at that time. We're right on the coast of Florida. The Space Center was founded in 1961 as the Manned Spaceflight Center. It opened up in 1963. Eventually, it became the Lyndon B. Johnson Space Center. And you can see it's like a college campus environment, and you see one of the space shuttle orbiters and the 747 that carried the space shuttle. At the Johnson Space Center, we have the Mission Control Center, and the Mission Control Center is the control for all space vehicles. This one is for the ISS program. This is the flight director's desk. This is where the flight surgeon is, and so the biomedical engineering and the biomedical engineering and flight surgeon are in the back to the right, and you'll notice here these plaques where the arrow is indicates where when you come to work every day and enter the Mission Control Center, you see right away the crew members that were lost during the Apollo 1 mishap, the Challenger mishap, and the Columbia mishap. I was a medical student my second year, and in 1987, when the Challenger exploded at launch, I still remember somebody running in. I was in a small classroom. We were having small group discussions. Somebody running in and saying, "Oh, the space shuttle just exploded," going to the student lounge and seeing that horrible image over and over again. And I have to say, it's just a real privilege for me to be working in a position where I can help prevent something like that from ever happening again. This is Building 9, which is the space vehicle mock-up facility at the Johnson Space Center. And as you can see, there's modules from the International Space Station. And so the astronauts train there. They enter the modules, and they go through their training of what it's going to be like when they're on orbit on the International Space Station. And in the interest of time, my focus is going to be on long-duration human spaceflight, primarily on the International Space Station. Here's the Neutral Buoyancy Lab, the world's largest pool, 6 million gallons, 40 feet deep. And this is where the astronauts train for their spacewalks. They call it neutral buoyancy because they're weighted, and so essentially they are not sinking or floating. They can essentially act as if they're performing their duties in 0G, and they perform 10 hours of training for every 1 hour of spacewalk time. Now, going into the history of human spaceflight, this started in 1961, April 12th. Yuri Gagarin, a cosmonaut in the Soviet Union, became the first human in space. And here's a statue at the Gagarin Cosmonaut Training Center in Star City, Russia, which is a small city outside of Moscow. And you see me standing there at its base. And you'll notice that Yuri's left arm is behind him. And that's because that while he was alive, every day he would bring flowers to his wife, Valentina. And so they put the statue up looking at the apartment building where she lived. And you can see flowers at the base of the statue. And still to this day, people that live in the area bring flowers to the base of his statue. Our program started with Mercury in 1961, and shortly after Yuri Gagarin launch, which was an orbital flight, several weeks later, Alan Shepard launched on a suborbital flight, and that triggered the space race with the Soviet Union. And so there was Mercury, then Gemini, then Apollo, which is the lunar mission, and then Skylab, which was our first 3 space station missions, Apollo-Soyuz, in which we docked with a Russian or a Soviet Soyuz. Then the era of the space shuttle began in 1981, and most of you probably recall seeing space shuttle launches. The first launch was April 12, 1981, which is essentially 20 years after Yuri Gagarin launched. There were 135 missions over the course of 30 years. And there is an amazing launch rate of 4.3 per year. The peak launch rate was in 1985, which was 9 flights per year. And then the Challenger mishap occurred in 1987, and there is a gap in human spaceflight because of that. The final landing was July 21st, 2011. And I'm going to take you to the launch of the STS-135.
All 3 engines up and burning. 2, 1, 0, and lift off. The final lift off of Atlantis. The shoulders of the space shuttle. America will continue the dream.
At the time, during the space shuttle, there was also the NASA's Shuttle Mir mission, which was 7 crew members launching on the space shuttle and docked with the space station Mir, a Russian space station. And this was our first modern era experience in human spaceflight. Now we're going to talk about the space station. The space station was first sent into orbit, or modules were first sent into orbit in 1998, and then it's been continuously crewed since 2000. It's a huge space vehicle, about the size of a 4-bedroom house. It orbits at 17,000 miles per hour at an altitude of about 250 miles. Here's a relative size of the space station compared to prior space stations. Salyut 1 was the world's first space station in 1971, and these are all Russian space stations. Salyut 6 was the world's first expedition quality space station, in which there was the first 6-month mission. Salyut 7, the world's first 8-month mission. Mir had the first year-long or more mission. You see Skylab, Tiangong 1 and 2 was the first 2 Chinese space stations, and the Tiangong right here, this is it's being built out, and so it's going to be probably the size of Mir once it's built out. But the 2 space stations that are in orbit right now are the ISS and then the Tiangong, which is a Chinese space station, and Tiangong means heavenly palace in Chinese. There are two types of space stations. The Salyut 1 and Tiangong, or at least the initial module, are called monolithic stations, in which the habitation module is sent up on a vehicle and left in place. Modular space stations like the ISS and Mir usually indicates a central module where the crew initially lives, but then it's built out over time in various modules. After the end of the space shuttle era, we began to solely be dependent upon the Russian Soyuz. And we have launched on this vehicle many times. It's very safe. There's been one launch aboard, but even that was handled very, very well. It's a crew of 3. It's very small crew accommodations, and it launches from the steppes of Kazakhstan. It's the Baikonur Cosmodrome on the steppes of Kazakhstan. We recently started the commercial crew program, where now we have SpaceX and we have the Boeing Starliner. As you're probably aware, the Boeing Starliner recently had its first crewed launch, but the crew remains on the space station because of technical issues with the vehicle, and that's something that Boeing and NASA are working on. But the SpaceX Dragon has proven itself, and there has been 9 crewed missions thus far. Here is the SpaceX launching on a Falcon 9, and then the Dragon is the capsule. It can be, usually it's a crew of 4. Here is the Boeing vehicle, where the launch vehicle itself is a United Launch Alliance booster, and then the Starliner is the capsule. Expedition 1 was the first crew on board the International Space Station. This took place in the year 2000, and the first commander of the ISS was astronaut Bill Shepard, who is a Navy SEAL. The first 6-person crew occurred in 2009, and that was the 20th ISS mission. So when you see ISS 20, that means it's the 20th expedition. The current expedition is the 72nd, and here's the current ISS expedition, and you'll note here there's Sonny Williams and Butch Wilmore, who were the ones that traveled on the Boeing Starliner, and then will be coming home on a SpaceX Dragon vehicle. Now, the longest single spaceflight in history was a cosmonaut who is a physician, Dr. Valery Polyakov. The longest stay in space on a single mission, 437 days. He launched in 1994, came in 1995, but it has not been done since. By far, that's the longest. The longest single spaceflight for a female is Christina Koch, who launched and was on the ISS for 320 days. And Christina is one of the crew members for the Artemis II mission, a crew of 4 that's going to be the first crewed human mission that's going to orbit the moon in late 2025. Scott Kelly and Mikhail Kornienko were the first one-year mission on the ISS. Scott Kelly, and you're probably aware his twin brother, also was an astronaut who flew on the space shuttle, and his brother Mark is a senator from the state of Arizona. Now, in part of my job, my primary role at NASA is that I'm in a senior leadership position as the division chief, but my technical role is I'm an aerospace psychiatrist. And so I get to work very closely with the crew members, and you see myself with Scott Kelly and 2 of my colleagues, Dr. Al Holland on the left, Dr. Jim Picano on the right. They're 2 operational psychologists. And we were meeting with Scott for his final post-flight visit before he left NASA and became a real celebrity. He wrote an autobiography, and he lectured. He still does. He lectures all over the world. Mark Vandehei was our next one-year mission. He's a retired Army colonel. And then Frank Rubio, current Army physician and colonel, who was on the ISS for 371 days. And Frank, he holds the longest single spaceflight record for a NASA astronaut. Now, the environment of care on the ISS is very unique. As you can see here, it is a very complex environment. It's very large. It is a working, operational environment. It was not designed for tourists, and you have to train to know you have to know where everything is, how to fix it if it breaks, and how to perform science and operations. And I'll take you through a view of the space station from somebody that has a camera on. This is sped up, but you can see both the size of the space station and its complexity. You'll notice that there's no clear floor or ceiling, that it's really designed to be a working environment. A lot of wires, a lot of hardware, computers, there's a science lab, there's areas to store things, there's ultra cold storage, and there's medical equipment, which I will show you. But everyone on board the space station has to train for a year or more after they're already a fully trained astronaut in order to travel there and to understand how it runs. And again, the key is you have to be able to fix it if it breaks. Here's the airlock. You see the two EMUs, or extravehicular suits. And then lastly, we go into the cupola, where many of the best photographs are taken. So you can see it's a very large vehicle, but also very complex. Now, if you're a physician, that is where you need to perform your care. This is a nice photograph of Tracy, who showed Al Holland and I, who were working with her during her mission. Every 2 weeks, we have a private psychological conference with astronauts. So we were having our usual private psychological conference with Tracy, and she said, "Hey, Gary and Al, I need to show you the view," because the cupola had recently been installed. So she turned the video around, we could see what she was seeing, and both of us said, "Tracy, you have to take a photograph of yourself looking out and seeing that and enjoying that." And she did, and this has become a real viral photograph of how beautiful the view is from the space station. Now we're going to switch to, what does a NASA flight surgeon do? Flight surgeon is an honorary title. A flight surgeon, for instance, in the military, is you're trained in aviation and aerospace medicine, and you're assigned to take care of pilots. A NASA flight surgeon is a physician that's trained in aerospace medicine that takes care of astronauts. And again, for those of you who are earlier in your career, there is a path to become a NASA flight surgeon. We need NASA flight surgeons to work in the flight medicine clinic. If you're a physician, you're assigned to several people on the astronaut corps, and you have to see them for their annual certification exams, and you have to be ready to see them or potentially their family members if there's a problem. You're fully trained to work on console, at the surgeon console in the Mission Control Center. And you can see here the surgeon console, this is the biomedical engineer, these two team up, and you can see here this is the International Space Station. I can't tell what's going on right here. It looks like they're getting ready to launch. But you have to know everything about the Mission Control Center. At the Mission Control Center, the flight director runs the mission. The ISS is controlled from the ground. The person that is in charge of the mission at any point in time is the flight director. And so if you're a flight surgeon and you're on console, you report directly to the flight director. Flight surgeons also are with their crews throughout their training. So if you're assigned to crews that are going to fly in space, whenever they're in the neutral buoyancy lab, you accompany them, you know exactly what they're doing for their training, and you're present when they're in the NBL. You also get to fly in the T-38. So if your astronaut's a pilot, then you get to fly in the back seat, and that's actually the most fun. Earlier in my career when I was on flight status, some of the best times I had were in the back seat of the T-38, flying over the Gulf of Mexico. It was myself and one of the crew members or an instructor pilot, and it was truly an amazing experience. Also, you're at every launch and you're at every landing when you're assigned to a flight. So here is Dr. Natasha Cho. She's board certified in emergency medicine and aerospace medicine, and she is working with astronaut Anne McLean. And so she's the one, this is a medical pack on her back. This is on the steppes of Kazakhstan, and Anne recently landed. And later on in my presentation, I'll show some details of landing operations. We're also preparing to work with crew members on the Artemis missions that are going to land in the Pacific, and also we work with crew members that land on the SpaceX Dragon that lands in the Gulf of Mexico, and I'll show more details of that in some future slides as well. Now, the pathway to become a NASA flight surgeon, of course, is you need an undergraduate degree, and then medical school, and then we usually prefer a primary residency. Most of our flight surgeons are either family physicians, internists, or emergency medicine physicians, but we have, I'm a psychiatrist, we have a neurologist, we've had a urologist, we've had individuals, their primary specialty is occupational medicine. 1 year when I first was there, we even had a pathologist, but they then did additional training, either in aerospace medicine residency, either in the military or at a civilian aerospace medicine residency, or flight surgeon training in the military. I received my flight surgeon training at the School of Aerospace Medicine at Brooks Air Force Base in the 1990s. And then once you're hired, you go through 1 to 2 years of training to become a NASA flight surgeon, and you eventually then get your wings as a NASA flight surgeon. And once you do that, you work on console, you're assigned to missions, and then you start working full-time. Now, if you're a physician, you have to understand the 6 tenets of human spaceflight. Every spaceflight mission, whether you're an engineer or a physician, you need to understand that they're all limited by mass, the mass of the vehicle or what you're launching to space, the power it takes to launch the vehicle, or the power to use the equipment on board, the volume or the size, time, how long is it going to take to build the vehicle or to prepare the equipment, how much money is going to cost. Right now, it's approximately $10,000 per pound to get into low Earth orbit. So of course, SpaceX and others are lowering the cost because of reusable launch vehicles and boosters. However, it's still very expensive. And then what's the risk? Is it worth it if you put something into space that is potentially risky, such as something that is potentially explosive or flammable? Here is an example. The ARED, which you'll see in another slide, a video of, is the exercise resistive equipment on the International Space Station. It's very heavy, it's very complex, but we had the vehicle to launch it, and the space station, as you saw, was large enough that it can accommodate it. However, on the Orion or on Artemis missions, we're going to have to be dependent on something we haven't used before, which is a flywheel, and it's purely related to the mass. This would be far too large to be either on the Lunar Gateway, the Orion vehicle, the lunar lander, or to get to the lunar surface. Far too costly. It would be basically impossible to do. Now, context is also king in human spaceflight. So again, imagine you're a physician and you are tasked with being a crew surgeon for a mission, and the flight director and others are coming to you and asking your opinion. So about crew, what pathology are you flying to space? What are the potential impacts to that pathology and physiology due to human spaceflight? What are the medications and countermeasures you have available to mitigate the risk? What are the nuances to the treatment that come about in microgravity? And I'll have some slides to show some of that. What if there's a medical emergency? Can you treat it during the mission? A big difference between low Earth orbit, where you can essentially do almost a pretty much immediate emergency egress from the vehicle and come down rather quickly within several hours, versus a lunar mission, where if you're on the lunar surface, you're on lunar orbit, it might take days. What if there's a deorbit? Where is the deorbit landing site? What are the potential for rescue forces? And where is the closest tertiary care facility? So if you're a flight surgeon, you have to understand this context and be able to plan for it in every way to lower the risk as much as you can. Our risk in terms of medicine starts with astronaut screening. We are able to lower the risk because we have a very detailed medical screening for all finalist astronauts. Usually there's between 30 and 50 finalists. They all go through very intensive medical and psychiatric screening. You can see the list and how detailed it is. Once you're selected, at least the last selection, they also had a brain MRI and a colonoscopy. The cost for doing those for everyone just became too much. But you can see everyone that is hired has to be, we would like you to be an astronaut for 20 years or more. Therefore, when you're hired, you essentially need to be entirely healthy. If you become unhealthy once you're fully trained, then we address it, and I have another slide to show you all the pathology that we've fixed and then flown. If you're a flight surgeon, you'll be assigned to your crew, and then you'll be with them through their training, their pre-launch, and launch, and then in-flight, and then their return. Pre-flight crew training. Most astronauts are not physicians. Some are. In fact, one of the astronauts that just returned, Dr. Mike Barrett, he returned from with Crew 8. He is a well-known physician, but most are not. And so every astronaut has to go through medical training on the ground. And if you're a crew surgeon or a flight surgeon, you're supervising that training with the other trainers, so you know for sure that your crew members know what to do in case there's an emergency. And you can see here the training. This is in the building I showed you, which was the Space Vehicle Mock-up facility, and this is actually on orbit. It's about 25 hours of additional training. Much of the training that we've designed occurred on the zero-G aircraft, which they call the Vomit Comet. And I'll tell you, after riding it, I understand why. It essentially does multiple parabolic flights in which there's about 30 seconds of microgravity each time. And so here on the left, you see this is on the Vomit Comet. They're practicing doing CPR. And then, of course, this is on the International Space Station, and it's very similar. But everything that is on the International Space Station was first practiced on the ground, either in zero-G, in the Vomit Comet, or elsewhere. Now, when you're assigned a crew, you're there for the pre-flight health stabilization program. Worst case scenario is an illness, an infectious disease that's brought to the space station and infects the entire platform. During COVID, it was a huge risk. And so if you're a flight surgeon, you live with your crew in crew quarters in the quarantine facility. The quarantine is about 14 days. We do require vaccinations. The crew contacts, if you're a chef, for instance, at the crew facility, or if you're one of these individuals that is helping them become suited, you have to go through your own pre-flight quarantine so that when you have direct contact, you don't infect the crew members. During COVID, this was extremely difficult, as you might imagine. And this is the DM2 mission, which is the first crewed mission on the SpaceX vehicle. You see Elon Musk and Jim Bridenstine, who was the NASA administrator at the time. That was during the Trump administration. I think that's one of our flight surgeons in the back, and that's the chief astronaut at the office at the time. This is Dr. Rob Mulcahy. This is Dr. David Picken. This is Crew 8. This is one of the SpaceX colleagues. And again, if you're a flight surgeon, you live in quarantine with the crew for those days. You know the crew very well. They know you. And the goal is for them to confide in you if they have any medical issues and you need to keep them safe to fly. Then there's launch. So you're with the crew and they're suiting up. In Florida, they take a Tesla to the launch site. In Kazakhstan, they're on a bus. And there's the launch. There's two crew surgeons, a prime crew surgeon and a deputy, and they're in different places depending on their role. The flight surgeons have to coordinate with search and rescue forces, including the Russian rescue forces. And then when the crew is in transit to the space station, you have your first private medical conference. Here is the crew going to the launch site at the Kennedy Space Center in a Tesla vehicle. Now, on the space station, the crew healthcare system is divided into three parts. The countermeasure system is essentially the exercise system. So think about crew health and fitness. Then there's the environmental health system. It monitors air toxins, water quality, radiation levels, and sound. If you're the flight surgeon, you have to be very familiar with all the intricacies of this. I'm going to speak primarily about the health maintenance system, which is essentially preventive care and medical care on the ISS. The ISS medical capabilities are fairly robust. They will not be as robust during lunar missions because of the tenets of human spaceflight, including size and power. We have ultrasound, medical kits, including oral meds, supplemental oxygen, there's a ventilator, IV fluids, ECG, we have splinting and wound management, and then we have very detailed ocular and ophthalmic hardware. The spaceflight medical kits are divided up into non-emergency medication, non-emergency hardware, and then emergency medication and hardware. And they're in different places on the space station, which I'll show you. So here's the crew healthcare system, or check stowage. It's in the US lab. And again, if you're an astronaut, you know exactly what's here and where. If you're a flight surgeon, you know exactly where to look, and the same with the biomedical engineers. So you open the doors, and there's essentially the medical kits. You open the medical kit. Here's one example. You'll notice that everything is labeled. So if you have a problem, you know where to go, you know what kit to open, you know what's in the kit, and then you can refer to your procedures. And if you need to, in real time, be talking to the flight surgeon in mission control who will tell you what to do to address a medical problem. A ground-based medical support occurs via the Mission Control Center. Our flight surgeons are on console from 7 a.m. to 4 p.m. Monday through Friday, and then essentially they're on call 24/7. So if you're a flight surgeon and your crew member is on orbit for a year, you're essentially working nonstop for that year. You might have a break between you and the deputy crew surgeon, but that's your primary focus for that period of time. Private medical conferences occur once a week. Private psychological conferences occur every 2 weeks. These are by private video. They perform private health or periodic health and fitness evaluations. There's on-orbit medical testing. You have to participate in the mission management meetings. The flight surgeons are part of the mission management team. So if there's a mission impacting medical event, you're speaking directly to the flight director, explaining what's going on and explaining the risk. Here's two of our flight surgeons. They're Dr. Padarini on the left and Dr. Cho and Dr. Johansson on the right. And again, by the time you're a NASA flight surgeon, you're fully trained, you understand how to operate everything on console. When you're on console, you also have to be there for spacewalk support. EVA support is the most difficult. It's the most challenging, physically and mentally difficult act that an astronaut performs, but it's also the most exhilarating. All astronauts that I've worked with, and I've been assigned to 40 ISS missions, they all want to perform spacewalks. But if you're a flight surgeon, you're monitoring their biomedical data in real time. You're monitoring all the concerns for DCS. You're monitoring them for CO2 symptoms. We had a near potentially fatal mishap with water in the helmet, and then, of course, rapid repressurization if necessary. The hazards and risks of human spaceflight are clear at this point. We understand these from all the work that we've done over the past 60 years of human spaceflight. Space radiation, unfortunately, I don't have time to talk about that. Isolation and confinement, and that's primarily in my realm of behavioral health. Distance from Earth, big difference between low Earth orbit and the lunar and then a Mars mission. Lack of gravity. Look at the long list here. I'm going to go through some of this. This is probably the one that's most difficult and causes the most problems. And then hostile enclosed environment, toxic exposure, hypoxia, sleep loss, hearing loss. So these two are probably the most significant. Human response to human spaceflight, it starts with launch and landing. There's microgravity, there's the closed life support system, confined habitat, and then, of course, radiation exposure. It produces all of these. Balance, cardiovascular, bone loss, muscle atrophy. It does decrease immune function, and there's visual changes. This slide is one of the most important. So when you're an astronaut, if you're a flight surgeon, your astronaut gets on orbit and they're a rookie, they're going to experience all of these. The otoliths in the inner ear respond differently to motion. There's changes in the sensory input that confuses the brain, causing occasional disorientation. The eyes become the main way to sense motion, and so you develop spatial motion sickness and feel nauseated. Fluid is redistributed to the head. So the fluid from your legs eventually goes to your head. The kidney filtration rate rises, and so the bone loss may cause kidney stones. The legs are shrunken. There are touch and pressure sensors registered no downward force, so you really don't use your feet. There's loss of blood plasma, and that creates temporary anemia, especially when we return to Earth, and weight-bearing bones and muscles deteriorate. Here's an example. This is Kjell Lindgren. This is his usual face, and then on orbit, it's basically ballooned up. Leg volume decreases by about 1 liter per leg, and forehead tissue thickness increases by about 7%. Now, whenever the human goes into zero gravity, it will always try to reach homeostasis. So there's a period of compensation in which sometimes you feel sick, you feel like you're in an unusual place, your body's not used to it. Then there's an inflection point in which it feels normal to you. I've worked with many astronauts who after about 6 weeks, they feel like they're at home and they could stay there forever. However, because of zero-G and because as humans, the two primary environmental issues that we grew up with, I guess from an ancestor perspective, were the 24-hour day-night cycle and 1G. So here's the time course of physiological changes during weightlessness. So first, the neurovestibular system. The clinical horizon is space motion sickness. And then shortly after that, fluid redistribution. There's a cardiovascular system effect, red blood cell mass. And here, there's a point of adaptation in which there's a zero-G set point in which you start to feel normal in zero-G. However, there's a continuing bone and calcium metabolism problems, and then you end up, over time, if you stay in space longer and longer, you end up losing bone and muscle mass. And I'll show you some of the... in the cardiovascular effects, there's an increase in ventricular size initially. There's a major increase in preload. There's an inhibition of erythropoietin. There's fluid shift to the upper thorax and the head. And then there's an increased GFR. So this produces changes in your cardiovascular system. The neurosensory response, essentially, you're not certain, hey, what's up, what's down? Eventually, there's an adaptation and a sense of being able to work in 4 dimensions, but initially your sense of up or down and is skewed, and then eventually you can change your perspective and you can determine what's up and what's down. Space motion sickness is very common. It affects about 80% of crew members. There's loss of appetite, nausea, and vomiting. Treatment, of course, is a 1G orientation, so if you return, it goes away. But medications, inactivity, and sleep, and pre-flight adaptation and training. Eventually, this goes away in about 1 week. The changes in zero-G cause what's called the SANS, or the Spaceflight-Associated Neuroocular Syndrome. There's changes. There's optic disc edema, choroidal folds, increased optic nerve sheath diameters, and altered blood flow from into the eye, and that's from zero-G. And it has caused intracranial hypertension. So there's been several cases known in long-duration crew members, each with different degree of symptoms, and that includes elevated intracranial pressure post-flight on lumbar puncture. There's also been several cases of thrombus in the left internal jugular vein. Again, we believe this is a risk of zero-G, and of course there's a risk of embolization to the lungs and development of pulmonary embolus. So because we've noticed this in several astronauts, we have Luvenox, Xarelto, and Eliquis on board if necessary. There are musculoskeletal changes during spaceflight. The osteoclasts continue to resorb bone, but the osteoblasts that are gravity dependent don't build bone like they used to. And so essentially, there's muscle atrophy and bone demineralization of 1 to 3% per month in lower extremities and the spine. For muscle, there's a decrease in body mass, decrease in leg volume. There's atrophy of the anti-gravity muscles, primarily the thigh and the calf. And here's a spaceflight bone loss, primarily in the pelvis, the thoracic, the lumbar spine, and the thoracic spine. But you see here, there is some loss. The only time, the arms and the head, which are primarily the ones that you use the most during spaceflight, there's no loss there. Potential problems because of the bone loss are kidney stones, fractures, and then reduced emergency egress capability. Now, in-flight countermeasures, there's 3 on the International Space Station. There's the treadmill, and this handles the neurovestibular, cardiovascular, and musculoskeletal. There's CVIS, which is essentially the resistance training, and then the ARED is resistance training. The CVIS is the cycle ergometer. And the next slide will show you all 3 of those. You notice the size of this, and it's vibration isolated, because otherwise it would shake and rattle the entire space station. But this is remarkably successful. You'll notice here, this is astronaut Terry Virts. He's bungeed down, and so there's downward force so that when you run, you're able to maintain your cardiovascular fitness and also your muscular fitness as well. And here's astronaut Drew Feustel. You notice that there's no seat. He is essentially tethered just to the back. Now, the last area we'll go through is state-of-the-art landings. We have developed some very robust landing skills. This is the steps of Kazakhstan for a Soyuz landing. And you see the size primarily. Usually there's 2 cosmonauts, there's 1 astronaut. This is flight surgeon Dr. Joe Schmid. Their commercial crew program, this is the Boeing landing that's in the deserts of the western United States. And then you've probably all seen the SpaceX landing in the Gulf of Mexico. Pre-landing preparations. When you're a crew surgeon, you work with your crew members to do fluid loading, including a combination of fluid and salt tablets, prophylactic medication. Otherwise, when you land, you become it's extremely provocative, and you can become extremely nauseated and vomit. And then there's orthostatic intolerance garments, and so these are wrapped around the lower extremities. The conditions in the capsule can be very hot. The chute opening can lead to injuries, and the G-forces, nominally up to 4 Gs, can be sustained, and can be up to 9 Gs if there's a ballistic reentry or something goes wrong. Landing medical concerns include exhaustion and fatigue, dehydration, orthostatic hypotension, neurovestibular systems, these are very common, heat stress, hypothermia, and trauma. This is the Soyuz coming over the beautiful, huge expanse of the steppes of Kazakhstan. It's 1 main chute. There's a landing that astronauts say that it's similar to like a minor car crash. Once on the ground, the capsule can be upright or on its side, and the Russians determine if the capsule needs to be tipped over or not. This is the landing area near Astana in Kazakhstan. This is the Baikonur Cosmodrome where the Soyuz launches are. Everyone is transported on these Russian Hind helicopters, and you can always see the NASA personnel by their blue. This is astronaut Scott Tingle, who I worked with. You could see him being extricated, and this is one of our nurses and the flight surgeon checking on him afterwards. You see the photographers here and a combination of Russian and NASA personnel. This is Dr. Cho and Kate Rubens, who has a PhD in microbiology. She's a scientist, and she returned during the height of the COVID pandemic, so very difficult. Being carried, the astronauts generally cannot walk when they've landed. They feel sick and very weak. Here's a nice tradition of bringing the women flowers. This is Dr. Cho from NASA flight surgeon. They bring them to the medical tent, or they take off their spacesuit. They get to clean up. They're given IV fluids usually and some anti-nausea medication. And then all of them are also tested as part of a research protocol that later funds it produces excellent data that we're going to use when they eventually land on Mars. This is an excellent photograph of Dr. Cho and a Russian nurse with astronaut Colonel Anne McLean, who's an Army colonel, after she's been taken from the medical tent and she's been flown to the NASA Gulfstream 5. The SpaceX launches from Florida, as you know, from the Kennedy Space Center, but then it lands off the coast of Florida. So this is the DM2 mission. The landing sites were Panama City or Pensacola, and ended up in Pensacola. This is flight surgeon Dr. Joe Dervais, and this is the SpaceX boat. This is where they recover the capsule, and this is the helicopter that takes them back to land. Here's splashdown of the SpaceX vehicle, the Dragon. They were able to retrieve it and bring it on board about 30 minutes later. Here is Doug Hurley and Bob Benkin, the first 2 that flew on board this vehicle. And here's Dr. Joe Dervais, one of our flight surgeons. This is Dr. Anil Menon, who was one of my colleagues at NASA. He then became SpaceX's first chief medical officer, and now he's an astronaut. We selected him as an astronaut. This is back at the Pensacola Naval Air Station, return plus 170 minutes, so very quick return. You'll notice the neurovestibular effects on landing. It really affects balance and posture, and pursuit and tracking or maintaining a gaze is very difficult. Again, this is after being in space for 6 months to a year. Time required to clearly focus on an image increases by 1 to 1.5 seconds relative to pre-flight. So this is prior to flight, very smooth eye tracking, and this is after flight. You notice it's very poor, and partly that's one of the reasons it causes people to feel sick. Our direct returns are on the Gulfstream 5 aircraft. The Gulfstream 5 has medical capability. There's usually 2 flight surgeons that return with every crew member and 1 flight surgeon that is specifically dedicated to flying the G5. They treat symptoms post-flight. There are some basic procedures they can perform. We do have advanced procedures, including an airway if needed. We have ultrasound, and then we return research specimens. I think this is the last data slide I have. So this is post-flight recovery, and this is mission duration. So space shuttle, which is approximately 10 days in orbit, recovery takes place in about 2 days. This is like the 95th percentile of recovery. So after ISS, for approximately a week. For Mars, we're uncertain. Post-flight conditioning, we have astronaut strength and conditioning coaches and athletic trainers, and that lasts for 6 weeks, and it takes place in their reconditioning facility. We have also a pool for them as well. Now, take a look at this list. These are all medical conditions that our team diagnosed in trained astronauts. We're able to repair that, fix it, go to the Aerospace Medical Board, and recertify it for space flight. So here, atrial fibrillation with ablation ×6, pancreatitis, VTAC, exercise-induced, long list. But in almost all of these cases, these are highly experienced astronauts that developed a problem. We were able to prove that essentially it was fixed, and they were able to fly again successfully in space. So we're developing a longer list of these medical conditions. Now, we've had a very successful record. In the 65-year history of NASA, there's never been an astronaut that's been needed. We've never needed to deorbit for a medical emergency. And that's despite every statistical model predicting that we would need to roughly every 4 years on the International Space Station. So we have a very robust, highly successful system that we've developed over the past decades. These are my last slides. Now, people always ask, hey, you're a psychiatrist. How did you end up in the position you're in? Well, after my forensic psychiatry fellowship, I had the urge to join the military, and so I was commissioned as an officer in the Ohio Air National Guard. And I was able to be fortunate to be trained as an Air Force flight surgeon, and that took place at the School of Aerospace Medicine in San Antonio, Texas, at Brooks Air Force Base at the time. During the training, somebody came and said, hey, if you would like to travel from San Antonio to Houston, we'll give you a tour of the Johnson Space Center. I said, great. So 3 of us in a rental car traveled. We're able to meet with some of the physicians that currently worked at NASA. And here you see myself at the surgeon console. This is the space shuttle console. And I got my Air Force hat on. Look, obviously much younger. That was 1998, I think, 1999. And I was with my friend, Dr. J.D. Polk, and here's part of the training. I turned to J.D. after the light went off, and I saw what could be possible. I said, J.D., we have to work here one day. Let's commit to do whatever it takes to come back here. And so J.D. got there first. He's now the NASA Chief Health and Medical Officer and leads the entire agency, and he's based at NASA headquarters. And 20 years later, I'm the Space Medicine Operations Division Chief. So it's been very unique, and it's been a wonderful journey. And I have to say that definitely it started at the CWRU School of Medicine. If it wasn't for Case, I wouldn't be here. Those are really some of the 4 best years of my life. I really loved the time I was here. Of course, back then, we started in 85, graduated in 89. We had chalkboards, we had the overhead projectors, and now we have this beautiful technology. One thing I have to say is that I went into medicine because I wanted to emulate the physician that I admire most. My father, Dr. Edwin G. Beven, who was a giant in the field of vascular surgery at the Cleveland Clinic. My dad is here, age 96, still as sharp as I am, or as a tack, and he remains my hero, and I've wanted to emulate him my whole career. And so I want to thank Dean Gerson, I want to thank my father, Dr. Beven, and all my classmates that I was here with, and I'm here happy to answer any questions, and thank you for having me. Appreciate it.
first of all, I should say thank you for your service, because it is a international effort and remarkable. And you take a lot of issues and things that you got to handle, and you do it so smoothly. So I'm appreciative in saying that we're appreciative of everybody in the room and everybody at this reunion. We have a small little gift. I'm allowed to give a gift.
Yes.
Of the Dean's Distinguished Lecturer Award, November 15th, Gary Beven, MD.
Thank you. Thank you.
All right, now I warned our students, and I'll encourage anybody in the audience, there's a ton of questions you could ask, so please do.
And I'm going to stay here for as long as I need to. So
Let me explain how. So if you, now I ask a question. Turn screen. Hold on to it, and it'll keep bringing you down.
yes.
A lot of what you do is on the realms of sci-fi that we read like 20 years ago. Has there been an outbreak ever on board? And is the ISS set up for quarantine? Like how does that work in such close quarters?
Yeah, so an outbreak of an infectious disease, correct? No, thankfully not. To our knowledge, there has not been the flu, as an example, COVID, or any infectious disease has gotten up, and that's because of the quarantine pre-flight. It would be very difficult if somebody, like for instance, as an example, one of the astronauts is on the space station right now, astronaut Pettit, Don Pettit. He is, I believe he's 68 or 69 years old, and brilliant person, very healthy. However, you don't want somebody that age to develop the flu, especially on orbit, because if you develop a serious illness, the only way to treat it, especially if the person becomes acutely ill, is you'd have to deorbit them, and there's a high risk in that. And you can't just send one person back. You'd have to send the entire crew back, because the rule is you always have to have, if you're on the board of the space station, you cannot be left there without a deorbit vehicle. And so, for instance, if I was an astronaut and Dean Gerson was one, and my dad was another one, if one of us got sick, we would all be coming back. You couldn't just put two in or one. There always has to be a means of return. So thankfully, we haven't had to deal with that. Yes, sir.
Are there any protocols in place looking at attempts to prevent some of the changes that occur with spaceflight? For instance, something like bisphosphonates to prevent neurological mass, something like that?
Yes. Well, the primary countermeasure is the exercise equipment. For instance, the ARED. And we've been remarkably successful. However, there is growing research that in a particular population of astronauts, they may respond potentially to the medication countermeasure that you mentioned. So to my knowledge, we haven't utilized it, but it's certainly possible, and we're developing enough data to indicate that they may be beneficial, especially for ultra-long duration missions on Mars, as an example. We haven't needed it on ISS. Unfortunately, the countermeasures on ISS are very, very successful. But for lunar surface operations, for Martian missions, that might be something that we would take advantage of. Carrie.
How long do the astronauts need to exercise to maintain their certain level of health?
Yeah, I forgot to mention that. Every day the astronaut's on orbit, you have a timeline or a schedule, and 7 days a week you exercise, and there's usually a 2.5-hour block in which that's your exercise time. Some of it is set up. You could tell, you have to bungee, you have to get undressed and dressed, you have to bungee yourself, but at least a full hour every day of exercise. And many of the astronauts that I work with are athletes, and when they don't exercise, they feel worse. They become more irritable, they don't sleep as well, and so it's a behavioral countermeasure and it's a musculoskeletal countermeasure. But that's a good question. And for any space mission, especially one that's 30 days or more, which is NASA's yardstick for a long duration mission, you have to exercise. Otherwise, you're going to have problems in your performance in the mission and also potentially when you return. Yes?
So is there any attempt to maintain some sort of circadian rhythm with light and dark cycles, and how successful is that? And my second question is, when they return to Earth, is there a period of time in which they need to get back into the 24-hour circadian rhythms that we're used to?
Yeah, sleep. I could give a full hour lecture on sleep. Every astronaut has a private sleep station. And it looks like, if you saw it, you'd say, oh, that's really small. But because it's 0G, it actually, when you go in and you could float, it's actually quite large. So astronauts have privacy. They usually have a little computer in there. They can watch movies. They can communicate directly with their family. However, the ISS, even though it's orbiting at 17,000 miles per hour, if there was windows, there would be several sunrises and sunsets every day. Like every few hours would be another one, and so it would really mess up your circadian rhythm. However, it's a 24-hour cycle. They are on Greenwich Mean Time, and so it's a regular work day. And so, the work day usually starts. They get up around between 6 and 7. They usually work until 5 or 6. They have dinner, and then they sleep. They have roughly an 8.5 hour sleep period. I've worked with enough astronauts to generalize, although I don't have the data. About a third of astronauts say that they sleep much better in 0G. The older astronauts, believe it or not, sleep much better because it lengthens their bone. Like if you have neck pain, if you have knee pain, if you have musculoskeletal pain, if you have osteoarthritis, it always gets better in 0G. And then when they come back, it returns. However, some people never find a comfortable space. They can't lay down. They have to figure out how to bungee themselves. And so a third sleep better, roughly a third sleep worse, and then a third about the same. But they have a lighting system as well. So in the morning, they can change the lighting system so it's a different frequency, blue light. During the day, they can change it again. And in the evening, it shifts more to red light frequency so that preparing for sleep. They do have medications on board. They have Sonata. They have Ambien. I'm using trade names, but everyone knows what those are. They also have Provigil, which is a stimulant that can be used if necessary, especially before critical events such as spacewalks. But we monitor their sleep-wake cycle, and they actually wear something called an ActiWatch that objectively records how much they sleep, and that's fed into a research study when they return. Yes, sir.
I'm aware of the benefits of manned space flight that accrue to us on Earth here. My specific question is about Mars. What additional benefits do you gain from manned space flight to Mars as opposed to non-space flight? Mars is uninhabitable. The atmosphere is all CO2. It's cold. There's no water. Man cannot live there. So why should we spend men there when you can learn from electronics and so forth?
Yeah, that's I guess a philosophical question, and people that work at NASA are asked that regularly. Now, interestingly, as most of you know, NASA is really paired up with and working very closely with major private spaceflight companies. SpaceX is probably our the largest company and the most successful. And I don't work for SpaceX. We have colleagues that do, so I'm very familiar with how they operate and their philosophy. But as many of you know, Elon Musk founded SpaceX with the ultimate goal of developing space vehicles that will eventually bring humanity to the Martian surface and eventually have a colony on Mars. Extremely difficult, but my understanding is they're still, at SpaceX, they're still focused on that eventual goal. Now, from a NASA perspective, the primary major program that we're under right now is called the Moon to Mars program. So you can look it up online, the NASA Moon to Mars program, where low Earth orbit is transitioning to the lunar surface. Eventually, we're going to have permanent lunar habitation. Our primary geopolitical competitor is China. China and the U.S. and our allies are trying to get to the south pole of the moon, where they have water and other minerals and other resources. Then the transition point will be to get the technology to work and to prove that we can do it eventually, the first human mission to Mars. Now, in terms of whether or not that's going to be successful, who knows? I was telling someone earlier today that I wish I could reduce my age, not just to feel better, to live longer, but so I could actually work longer at NASA so that one day I could potentially see the first human mission to Mars. And you can argue about whether or not, hey, should we spend the money on this or not? But I think I believe it's going to happen, and I think that as a human species, we want to prove that we can do it. Whether or not we'll be successful, I hope I'm alive to see it. The funny thing is, since I've been at NASA since 2005, and someone always says, hey, we're going to go to Mars in 30 years. And every year they say the same thing. It's going to be in 30 years. And now we hear the same thing. It's going to be in 30 years. So whether we're going to go, I hope we do, but it'll probably be in about 30 years. So, yes, ma'am.
Take the data that you have currently and then extrapolate it to think about missions like Artemis. We'll have different levels of gravity, which means they're leaving Earth and then going to the moon, and different radiation. So it varies, different from that low Earth orbit. How do you extrapolate to what you've already learned to think about this complex and dynamic missions?
Yeah, so you referenced two of the risks, gravity and then space radiation. Of course, we have space radiation physicists that work in our division, and of course there's going to be a greater exposure to space radiation because we're beyond the low Earth orbit. And also, the moon is 1/6 G. So it's an open question of whether or not spending time on the lunar surface is going to mitigate some of the medical problems or the body's adaptation to 0 G. I don't think anyone knows yet. Mars is 1/3 G. The moon is 1/6 G. I will say, though, that many of the medical problems that we've noted come from reduced gravity. And so there is one space station company. It's a private space station company. The name is VAST, and they're designing space stations that will rotate, and we'll see if they're successful. But we do have teams that are currently working to determine whether or not the 1/6 G will be enough risk mitigation to change some of our countermeasures, including exercise, because of the difficulty and the mass of sending an exercise device into lunar orbit. The way in which we're currently planning for lunar missions are launching on the Orion capsule that's going to be underneath a huge booster vehicle called the Space Launch System. The Orion is going to dock with a space station orbiting the moon called the Lunar Gateway. There's 2 human landing system companies now that are developing the lander, SpaceX and Blue Origin, and so the lunar landers are going to be docked to the Lunar Gateway. So a team of astronauts, usually 4, going to launch from Earth, dock to the Lunar Gateway. 2 will then get onto the human landing system from SpaceX or Blue Origin, descend to the lunar surface, perform lunar surface operations, and the lunar surface operations will include, obviously, habitation, and then we're working on 2 vehicles. An LTV, which is similar to the Apollo buggy. It's going to have either room for 2 or 4 individuals, and there's 3 companies that are designing it now. Essentially, it's like a golf buggy. It's non-pressurized, so you're going to have to be in your spacesuit. And then there's going to be a pressurized vehicle. The pressurized rover is being designed by our Japanese colleagues, and their primary contracting company is Toyota. And that's going to be a large pressurized vehicle, and if you're an astronaut, you're going to the lunar surface, you get into that, and in theory, you'll be able to travel in it for 30 days to other parts of the lunar surface, and inside, you'll be able to take off your spacesuit. And then you probably travel to a part of the lunar surface where you put your EMU on and then go on spacewalks onto the lunar surface. So again, that's over the course of the next, let's say, 10 to 20 years. If you go to the NASA website, it has all that lined out, but that's the current plan for Artemis missions. Yes, ma'am.
I have a question about the neurovestibular symptoms. 2 questions. One is doing vestibular exercises before and
For vestibular symptoms, primarily Phenergan is the primary one I would say that we have the most experience with. Exercise prior to flight and in flight doesn't usually mitigate the space motion sickness. However, I have noted that rookies or astronauts that fly to space for the first time generally tend to have worse space motion sickness than people that have flown in space for the second or third or even a fourth time. I've worked with a number of astronauts that have flown to the space station numerous times, and interestingly, they tell me that when they get back to the space station, even though they may not have been there for the past 5 to even 10 years, everything there is still embedded in their cerebellum and in their psyche, and they feel like they've never left. And they're like within a day or two, it's basically back to the way they were years before. So the body really adapts to zero-G very, very quickly. And if you can watch the video of the astronauts, playing games and throwing things and goofing around, and the inflection point, as I showed you, is about 6 weeks. Almost universally, after 6 weeks, people feel very, very good. But to answer your question though, exercises really haven't shown any significant mitigation effect that I'm aware of. Yes?
So earlier you had mentioned that spaceflight causes alterations in bone density and muscle mass. I was wondering if you could go into a bit more detail on what the rehabilitation process for that looks like for astronauts.
Yes, well, you saw the in-flight. In-flight is essentially exercise. Once they return, they're assigned a team that's usually led by one of our ACERs, astronauts strength and conditioning and rehabilitation. Usually we have a team of athletic trainers, certified athletic trainers, strength and conditioning coaches, and we have one doctor of physical therapy who's actually, she works for the Air Force, and she's assigned to NASA full-time. All the astronauts have an individual ACER, we call them. And so if you're an astronaut, you come back, the first day you're back, you are bombarded with, you're having your blood drawn, you're having EKGs done, you're having an MRI, because all the astronauts sign up for science. They realize that part of the reason they're doing it, and our tax dollars are paying for them, is for them to give back to the scientific community. So all of them are essentially not guinea pigs. They have to go through a process in which they give informed consent. If you're a flight surgeon, you're there at the time that the research community is explaining the study. You have to give signed consent. It goes through an IRB protocol, and then when you return, you know what you're going to do. You have a schedule. Now, in terms of exercise, there's no downtime. So the very first day, you're up, you're feeling sick, you can barely walk, your butt hurts because you can't, you haven't used your butt to sit for a very long time. You just don't feel good. You're in the gym, and I've seen the ACERs, and they don't let you off the hook. They work you just like you're an athlete in rehabilitation. Like if you had a knee replacement, and you said, oh, here, you got to bend it. No, you got to do it more. It's very successful. And in fact, that period of time lasts about 6 weeks. Usually they return to driving in about 2 weeks because their vestibular system is getting back to normality. But I've seen astronauts after I meet them at R+3. So I have my private meeting with them. It's an hour long, 3 days after their return. And I have seen some astronauts look like they've never been in space at 3 days after their return. Others, you can tell they still feel sick. They're walking very slowly. It's very individual. And there's one thing we have learned. There's no way to predict ahead of somebody's flight if you have a rookie. Let's say you have 5 people that are flying to space for the first time. There's no way to predict based on their sex, their age, their profession, or anything of how people are going to respond, whether or not, oh, this person's going to have space motion sickness, oh, this person won't, or this person's going to feel this way. There's no way to predict. It's one of those things, until you get there, you don't know. And then then you have the countermeasures. So it's very, very interesting. It's very, very individual, and it's very idiosyncratic. Yes?
So you showed a long list of medical issues that arise, but you're a psychiatrist. I don't think you listed too many psychiatric issues observed in the psychiatric space?
Good question. Well, first of all, that starts with selection. I would say the easiest part of selection is for behavioral health. The behavioral health component of selection involves two parts: psychiatric screening, and then the hardest part is psychological suitability. So psychiatric screening, you might imagine, is I'm paired up with an experienced psychologist. We have access to all their medical records. Let's say, Dean Gerson, that you're coming from the military. Let's say that you're a military aviator. We already have all your military records. You go through a very detailed 3.5-hour examination. Plus, you also spend an entire week with us at the Space Center going through a variety of exercises: individual performance, group performance, interviews. It's very difficult. It's very difficult to become an astronaut to begin with. Usually you have about 10,000 people that apply. Then it's cut down to about between 400 and 600, and then maybe 300. Then we have 120 people that come on site that are semifinalists, and then between 30 and 50 that are finalists. The finalists go through what I showed you, that long list of all the medical testing and psychiatric screening. And then, once they're selected, they go through a training of several years. Usually it's between 1.5 to 2 years where you're called an ASCAN, astronaut candidate. So you have to go through a training period of time. You're under observation, and we have an embedded psychologist. The last 2 classes, we have an embedded psychologist as part of the class. They're not astronauts, but they travel with them. They go through winter survival training, summer survival training, water survival training. They go usually on a NOLS expedition into the wilderness. They go on geology expeditions, and we have a psychologist that's with them, observing them, and there is a resource. Our goal is to build what's called expeditionary skills and resilience. So by the time they're in space, they're really fully trained. But in terms of psychiatric, by the time we see them, it's very rare that we note a potential psychiatric illness, because by the time they reach us, they've already had a proven, highly successful career in which really they're at whatever the profession they're in, whether they're a PhD engineer, a scientist, a military test pilot. They've proven themselves over and over again, because not only that, you have to have the technical skills, but you also have to have, many of them have skills that are unbelievable. They'll come to us and they'll have foreign language skills. They're mountaineers, they're master divers. They're so well-rounded in so many areas, and plus they have the personality skills. They're usually humble, have good senses of humor. They get along well with other people. They're natural public speakers. Usually they're service-oriented and they're mission-oriented. And so altogether, the astronauts that you see are very admirable people. And if you go to the astronaut bio, if you look at the bios online, that's not hyperbole. There really are people like that, which in today's day and age actually makes me feel good to know that there are people like that. And they're all government employees. None of them are making very much money. They're either military salary, or they're on a government salary. But essentially, it's very, very unusual for there to be a psychiatric problem in an astronaut. And we have a robust system in which, over time, they learn to come to us proactively. I meet with all the astronauts annually as part of their flight medicine examination, and so I'll spend an hour with all of them over the course of their career, and by the time they retire, I've gotten to know them very, very well. And the nice thing is, they know that they can trust me and our psychologists, so that if they have a problem, something that could lead to potential performance decrement, such as going through a divorce, dealing with a teenager that has a substance abuse problem, you name all the things in life that can cause people to have behavioral health decrement, they'll come to us, allow us to help them. Because once they're selected, we tell them, it's very similar to if you're on a sports team, you're an Olympic team. You're selected, you made it through, now you work with us, because our job is performance optimization. We're not trying to prevent you from going to space. We want you to perform optimally in a very difficult, hazardous place. And so please trust us. We're the experts in this. We've been doing it for years, and that's why we develop really close relationships with them. Yes?
So what are physiological detriments around and when there are too great requiring return? And also, are these changes permanent upon return to Earth?
Permanent physiological changes?
Yeah.
Most of the changes are not permanent. However, I referenced spaceflight-associated neuroocular syndrome. We have actually had some astronauts that have had permanent visual acuity changes and also permanent signs of intracranial pressure increases. We don't understand it. And so that's one of there's many papers that have been published on SANS. We have an entire team of scientists and others that are working on it, but it's still a mystery. But for the most part, if you see an astronaut like astronaut Scott Kelly, and you ask him, hey, how do you feel? Do you have any permanent damage from space? The answer is generally no. Of course, space radiation, we try to limit space radiation exposure so that over the course of a lifetime of the astronaut, it increases the risk of cancer. The increase of the cancer risk is less than 3%. So it's very similar to an occupational exposure that you would have if you worked as a radiation oncologist. All the astronauts, when they're in orbit, they're wearing a personal radiation detector. The vehicle has a radiation detector and is very closely monitored. And then if you break that limit, then you essentially, you wouldn't be certified to fly in space again. And that's a concern for a Mars mission. Let's say if we're looking for the first astronauts to fly to a Mars mission, you wouldn't want them in general to be rookies. So they would need to prove themselves in some type of an analog, either low Earth orbit and a lunar mission. But you'd have to look at the projected radiation exposure during a Mars mission and what their exposure has already been. And so we have a group of people that's all they do. All they do is space radiation. The problem is, as Dean Gersten and I were discussing prior to this, there's no shielding. There is some minor shielding if you get behind on the space station in an area that has thicker walls or behind water. But for like a Mars vehicle, the shielding would be very heavy, and you wouldn't be able to get into orbit. And so that's going to be a major problem. Yes, sir.
Are there any procedures or treatments that we currently do now that we can specifically relate to lessons learned from people being in space?
That's a good question. So the question is, hey, what have we learned from human spaceflight, from a medical perspective, medical standpoint? I would say one of the best ones is use of ultrasound. We have developed a number of techniques in ultrasound that are now commonly used even in emergency departments. For instance, abdominal ultrasound, the techniques that are used by trauma surgeons now, it first started with the use in human spaceflight, and that's well known. In terms of others, I would be happy to get you a list. I just don't have them in my head right now. But yeah, that's a great question.
Well, this has been an absolutely stimulating presentation. I hope you can tell by the questions how much interest there is in the subject. Boy, are we glad you're a friend of the University and the School of Medicine, and that you're leading this incredible effort for the nation. So thank you for what you do. I'm going to let us break, and if you want to come up and have a quiet conversation and ask questions, please do so. And of course, big soiree is happening in an hour or so outside. So thank you all for joining us, and look forward to the next part.
Thank you.